Hello everyone, welcome to our channel. In this video, I am going to explain the causes, symptoms, prevention and the treatment of hypertension. First we gonna see what is blood pressure. Generally, the heart pumps the blood through blood vessels to various parts of the body. In these blood vessels, at what pressure the blood flows is measured by the blood pressure. Generally, the normal BP is 120 by 80 millimeters mercury. When the blood pressure rises above this value, then we call this condition as hypertension. There are various causes of hypertension. First is genetic. It occurs because of some genes. And second most important reason is stress. Whenever there is stress, there is increased epinephrine release, which in turn increases the vasoconstriction and thereby increases the blood pressure. And people who have high sodium intake, like salt, whenever there is high sodium, there is increased vasoconstriction, increased water retention, thereby increases the blood volume and increased blood pressure. And people who have low potassium intake also, there are chances of BP. Why? Because potassium is a vasodilator. It dilates the blood vessels. But when there is less potassium, there is increased vasoconstriction and increases the blood pressure. And people who are obese, people who excessive intake of alcohol, excessive smoking, and in conditions with obstructive sleep apnea, and people who have old age, there are high chances of high BP. Why? Because as age increases, the blood vessel stiffness will be increases and it increases to the blood pressure. And people who have heart problem, kidney problem, liver problem, and certain blood disorders like sickle cell anemia, in these conditions also there are high chances of increased blood pressure. Coming to the symptoms of hypertension. Generally, the hypertension we call it as silent killer. Why? Because it doesn't have any symptoms. Whenever there is excessive increase in the BP levels, then only there are certain symptoms will be seen like headache, difficulty in breathing, nose bleeding, dizziness, chest pain, blood in urine. These symptoms may be seen when there is excessive increase in the BP levels. Coming to the prevention, we can prevent hypertension by lifestyle modifications like less salt intake, less intake of pickles, junk foods, and increased potassium intake, and we should cut the drinking alcohol, cigarette smoking should be reduced, and regular exercise should be done, and we can reduce the stress by meditation, etc. Coming to the treatment of hypertension, we can reduce the blood pressure levels by advising certain medications. So I'm going to explain the foods to eat and avoid in high blood pressure. So we should eat the foods which are rich in omega-3 fatty acids to improve the heart health. Whereas we all know that the blood is passed through the blood vessels. So we should eat the foods which are rich in potassium, which improves the vasodilation, and we should avoid the foods which are rich in sodium, which causes the vasoconstriction. To explain in detail, potassium is a vasodilator. It dilates the blood vessels. It widens the blood vessels. It decreases the blood pressure. Whereas sodium is a vasoconstrictor. It narrows the blood vessels. It increases the blood pressure. So we should eat the foods which are rich in potassium. We should reduce intake of sodium rich foods. And American Heart Association has given DASH diet, which is nothing but the dietary approach to stop hypertension. They recommend to eat plenty of fruits, vegetables, whole grains, that is brown rice, cereals, oats, whole wheat bread, etc. We should limit intake of sugar, saturated fats like dietary meals, etc. And we should also consume fat-free or low-fat dairy products. And we should eat food like fish, poultry, beans, veggies, etc. With this basic information, we're gonna discuss about the foods to eat in people with high blood pressure. They should consume citrus fruits like grapes, oranges, apricot, avocados, bananas, etc. They can consume coconut water, whereas in fish they can consume tuna fish, salmon fish, peas, potatoes, etc. In the dry fruits, raisins, dates, walnuts, pistachios are better. In the green leafy vegetables, spinach, beetroot, tomatoes, beans, carrots, etc. Whereas in the seeds, pumpkin seeds, chia seeds or flax seeds are very better to consume in people with high blood pressure. Now we're gonna see foods to avoid in hypertension. We all know we should avoid consuming high sodium foods like salt, pickles, junk foods, packaged foods, potato chips, etc. This is all about the foods to eat and avoid in high blood pressure. When we go to the doctor normally measures the blood pressure as 120 by 80, 130 by 100, etc. 120, the upper value indicates the systolic blood pressure and lower value indicates the diastolic blood pressure. What is systolic blood pressure? Systolic blood pressure, it is nothing but it's the pressure exerted by the blood when the blood vessels contract. Whereas diastolic blood pressure, it is the pressure exerted by the blood when the blood vessels relax. This is all about the systolic as well as diastolic blood pressure. These systolic and diastolic blood pressure varies from person to person. Now we'll go with the blood pressure levels chart. In normal persons, systolic blood pressure is under 120, whereas in diastolic blood pressure is under 80. In pre-hypertension people, systolic blood pressure ranges from 120 to 139 and diastolic blood pressure ranges from 80 to 89. People with pre-hypertension can reverse these levels by maintaining a healthy lifestyle and having a healthy diet and regular exercise. Next comes the stage 1 hypertension. In stage 1 hypertension, systolic blood pressure is 140 to 159 and diastolic blood pressure is 90 to 99. And similarly, stage 1 hypertension people can also regulate the blood pressure by having a healthy lifestyle. In case even after maintaining a healthy lifestyle, blood pressure does not comes to the normal, they are provided with the medications. Next comes the stage 2 hypertension. In stage 2 hypertension, systolic blood pressure is greater than 160 and diastolic blood pressure is greater than 100. In stage 2 hypertension, to control the blood pressure levels, healthy lifestyle should be taken and proper medications should be taken. And last comes the hypertensive crisis. In hypertensive crisis, systolic blood pressure is greater than 180 and diastolic blood pressure is greater than 110. And hypertensive crisis is a medical emergency and it should be consulted immediately. Doctor consultation is very important. In people with hypertensive crisis, they have headache, dizziness, and in severe cases they may also have stroke. This is all about the blood pressure level chart in different people and different. In this video, I am going to explain about the hypotension. Hypotension is also known as low blood pressure. When the BP levels falls below 90 by 60 millimeters mercury, we call it as hypotension. Coming to the causes, there are so many causes of low blood pressure. First and foremost thing is dehydration. We all know blood consists of 70% of water. So any problem with the water loss, there is low blood pressure. So conditions with vomiting, diarrhea, and those people who take less water intake with fever, excessive sweating, these are all leads to dehydration and in turn leads to low blood pressure. And in conditions where there is excessive blood loss, like in conditions with trauma and stomach ulcers, there is low blood pressure. And problems associated with the heart, like valvular stenosis, arrhythmias, heart failures, and certain medications like beta blockers, calcium channel blockers, depressions medicines like amitriptyline, levodopa, they may lead to the low blood pressure. And the most common cause of low blood pressure is postural hypotension. If a person stands up after prolonged sitting or prolonged lying down, the person feels dizziness, lightheadedness, etc. This is called postural hypotension. To understand this condition, I'll just quote an example. Take a water bottle and make it in a horizontal direction, place it in a horizontal direction. We can say that water level will be equal on all the sides. But if we place the same water bottle in a vertically, we can see that the water level will be pulled down, that is water level will be settling down. In the same way, if the person lies down, the blood will be equal in all from head to toe. But if he suddenly wakes up or if he suddenly stands up, we see that the blood pulls down. It's common in all people, but in old age the compensatory mechanisms will not work that efficiently. So this, because of lying of pulling of blood in the legs, this postural hypotension is seen. And coming to the symptoms of low blood pressure, we know that if there is low blood pressure, there is less glucose and amino acids reaching the organs. So the person does not have the energy to work. So the person with low blood pressure feels weakness, dizziness, fatigue, tremors, shaking of hands and feet, and the person have excessive sweating, and the person's skin will become cold, pale, and clammy skin will be there. In severe conditions, there are also irregular heartbeat may also be seen. These are all the symptoms of low blood pressure. Coming to the treatment, first we should treat the low blood pressure depending upon the symptoms. If the low blood pressure is because of the dehydration, we should give some excess, we should advise the patient to drink more water or giving excessive fluids, electrolytes, and in severe conditions we also administer intravenous saline. And very rarely doctors may also give tablets like fludrocortisone, which helps the kidneys to retain water. And if the low blood pressure is because of the blood loss, then doctors advise blood transfusion. Tension is caused because of medicines like hypertensive drugs and because of antidepressive drugs, then doctors may change the medicine dosage or they change the drug also. So this is all about the treatment. Coming to the prevention, we can prevent the low blood pressure by drinking lots of water and certain dietary modifications like drinking salt water, etc. According to the recent guidelines, they say that the maximum dietary intake of salt per day is 5 grams, and avoid long periods sitting or standing, and moderate alcohol intake should be done. Excessive alcohol intake may also cause low blood pressure, and make sure your drinking coffee should be limited. And to increase the red blood cells, consumption of certain juice like beetroot juice, pomegranate juice, wheatgrass juice may also help. And the last is the maneuvers for low blood pressure. So if a person feels that dizziness, lightheadedness because of low blood pressure, certain maneuvers may also help, like cross leg maneuver, buttock clenching, squat position, body tensing position. These all maneuvers may also help to prevent the low blood pressure. This is all about the hypotension. I am going to explain how to check blood pressure at home. This is the basic BP monitor, and this is the BP monitor. And in the BP monitor, SYS means systolic blood pressure, DIA means diastolic blood pressure, and this is the power button. M means memory, and this comes the cuff, and this is the tube. Whenever we check blood pressure, we should not measure the blood pressure immediately after smoking, after drinking alcohol, after exercise and immediately after taking bath. We should wait at least 15 to 30 minutes before checking blood pressure. And also, main important thing is we should empty the bladder before checking blood pressure. Urine should be passed out before having or before checking blood pressure. Why? Because if the bladder is full, the readings may alter. Whenever we check blood pressure, patient position is very important. Patient should place their feet flat on the floor and they should lean against the back of the chair. There should not be any legs crossing, there should not be any forward bend position, etc. We should place the feet flat on the floor and the back should be in a resting position with a lean on the back. Similarly, cuff placement is also very important. Generally, we should place the cuff on the bare upper arm. If we place cuff on the shirt, there may be differences in the reading. So, better to place the cuff in the bare upper arm and it should be placed half to 1 inch above the bend of the upper arm or above the elbow. And the tube should fall over the center of the arm so that the pipe will align around in the straight line with the middle finger, and we should place the cuff and pull the cuff so that it is even tight. It should not be so tight or it should not be so loose. It should be in such a way that we can slip 2 fingers under the top edge of cuff, and we should press the start button and the BP readings will start. BP cuff will inflate and cuff will deflate. In this time, the patient should remain calm, should be quiet, should not talk with the others, should not talk on the phone, etc. They should be calm enough and they should not have any stress. In this time, the cuff will inflate and deflate. After a minute, the BP readings will be displayed on the monitor. The first reading is the systolic blood pressure and the second reading is the diastolic blood pressure, and we can also see pulse in certain BP monitors. And whenever we take BP readings, we should take at least 2 to 3 measurements and average it for the correct BP levels. And during this, and we should wait, once we check the blood pressure, we should wait at least for 1 to 2 minutes before taking another measurement. This is all about the blood pressure measurement, how to check BP at home. In this video, I am going to explain about the BP tablet names. What are BP tablets names? Are antihypertensive drugs. For anything to work, we should get a stimulus from the brain. So, first class of medicines will work in the brain as the heart pumps the blood to various parts of the body. Some class of medicines will work at the heart as blood is flown in the blood vessels. Some part of medicines will work at the blood vessels. And also kidneys also play an important role in maintaining the blood pressure. Why? Because in kidneys, it helps to reabsorption of sodium, water or sodium water excretion, thereby in turn maintains the blood pressure. So, some sort of medicines will work in the kidneys to regulate the blood pressure. First class of medicines is the central sympatholytics. This central sympatholytics will work in the brain. There are certain receptors in the brain which give stimulus to the heart to reduce the heart rate or to reduce the vasoconstriction so that the blood pressure will be reduced. In central sympatholytics, the drugs will be clonidine and methyl-dopa. But there is one side effect with this central sympatholytics, that is sedation. As these drugs work at brain, there are chances of sedation, etc. And other class of medicines are beta blockers. Beta blockers work in the heart to reduce the heart rate, to reduce the cardiac contractility, so that the cardiac output will be reduced and ultimately the blood pressure will be reduced. In beta blockers, there will be propranolol, metoprolol and atenolol drugs. These beta blockers are the first line medicines prescribed by the doctor, and among the beta blockers, metoprolol is most commonly used to control the blood pressure. And the next class of drugs are alpha blockers. These alpha blockers works in the blood vessels to reduce the blood vessel or vasoconstriction, thereby reduces the blood pressure. In alpha blockers, there will be prazosin, doxazosin, etc. But the main disadvantage of these alpha blockers, that is, using alpha blockers causes tachycardia. It means increased heart rate. So to overcome this problem, alpha and beta blocker combinations like labetalol, carvedilol has been used. These alpha plus beta blocker combination medicines are generally prescribed in people who have blood pressure along with heart problem. And the next class of medicine is the vasodilators. Vaso means blood vessels, dilator means widening. So whenever these vasodilators are used, the blood vessels are widened and the pressure in which the blood flows are reduced, and ultimately blood pressure is reduced. In vasodilators, calcium channel blockers like nifedipine, amlodipine, verapamil are included. Among the calcium channel blockers, amlodipine is the most commonly prescribed drug to control the blood pressure. But there is a side effect with the amlodipine. As amlodipine causes systemic vasodilation, there are chances of blushing, headache, leg swelling, gum swelling, etc. And there are other vasodilators like direct arterial vasodilators like minoxidil, hydralazine, which is less commonly used to control the blood pressure. And other class of medicine is nitrodilators. In these nitrodilators, it releases the nitric oxide which dilates the blood vessels and decreases the blood pressure. Generally, these nitrodilators are used in conditions where there is surgery, the person has increased hypertension, which a condition called acute hypertensive crisis. In such conditions, nitrodilators are generally used to control the blood pressure. In nitrodilators, sodium nitroprusside and nitroglycerin are generally, these nitrodilators are used to control the blood pressure. And the other category of medicines work on the kidneys. Among that, thiazide diuretics like hydrochlorothiazide, chlorthalidone are most commonly prescribed medicines. And other category is angiotensin converting enzyme inhibitors like captopril, enalapril, lisinopril. These angiotensin converting enzyme inhibitors helps to reduce the vasoconstriction and also increases the sodium and water excretion by the kidneys, so that the blood volume will be decreased and the blood pressure will be reduced. And there are angiotensin receptor blocker medicines like losartan, valsartan, telmisartan. These angiotensin receptor blockers are generally used in patients who have blood pressure and patients with diabetes. In such conditions, these medicines are used. This is all about the BP tablets and their names, how they work. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.